Hi there, my name is Brittany Clark and I'm a speech language pathologist from Evergreen. Today I'll be talking about what does a speech pathologist, or SLP, do in aphasia therapy, and I'll be specifically talking about our collaborative Intensive Aphasia Program. A speech pathologist will assess all areas of communication affected by aphasia. So we'll look at how does that person get their message out, and then how do they do with getting their message in. So we know that every person with aphasia is different, and for some, they may have difficulties with speaking, understanding, reading, and writing. So as the speech pathologist, I'm looking across all of these different domains to see how the person with aphasia can communicate. I'll be looking at what are their strengths in communication, and then where are their challenges, or where do the communication breakdowns happen. And so, for example, here with this water bottle, the person with aphasia knows what they want to say, but often the word doesn't come out right away. And so I'll be looking at, can they name this object if I show them the picture? Could they ask for water if they were thirsty? Can they write maybe even the first letter or the word water? Could they describe it? And those are examples of how I'm looking at what are the strengths, and then how can we use those strengths to bolster some of those challenges that they have in communicating, and use those as ways to express themselves in a multimodal way. Goal setting is very collaborative, and it's done with the client, not for them. It's based on what matters in your daily life. So we've had a client examples where someone wanted to work on reading to their grandson, and that was very important to him, and so that became a wonderful goal that we worked on together in therapy. Another client wanted to order a coffee at Tim Hortons instead of having his wife order for him. For some people, it's something like sending an email or a text message. And so we look at what are those things that are important to you, what are your values, and what are some of those things that you want to get back into in your life, like communicating with family members or going out into the community. Aphasia is really different for every person, and so treatment plans are built around the individual. Therapy involves structured practice, and we gradually reduce our support as the person gains strengths in those skills. The big picture means that the speech language pathologist isn't just looking at test scores. We're really looking at helping someone communicate in the ways that matter to them and in their life. We want to rebuild confidence in conversation. In our intensive program, the speech pathologist and the behavior analyst, or the RBA, work together collaboratively. So the speech pathologist will do the assessment, look at some of those real-life goals, and support conversation. The behavior analyst looks at language across situations and individualizes treatments or teaching strategies, and then looks at the data and the progress monitoring over time. Our approach is looking at what are those meaningful communication goals. Then we'll assess the skill across those different situations. We'll create a customized teaching procedure where the speech pathologist and behavior analyst are writing those teaching procedures together to use the best of both of our fields. We collect ongoing data, and then we adjust the plan if needed, and then move the skill into real-life practice. We work together to help people communicate in ways that matter to them.